Tuberculosis, commonly referred to as TB, is a highly infectious disease that mainly attacks the lungs. According to the World Health Organization, TB is the 13th leading cause of death and the second leading infectious killer disease after COVID-19. But what causes TB? TB is caused by a bacteria known as Mycobacterium tuberculosis. The bacteria spreads from person to person through the air. Being near someone with TB puts you at risk of infection. When a person with TB bacteria sings, laughs, coughs, sneezes, or spits, TB germs are propelled into the air. These germs can stay in the air for a very long time, and you only need to inhale the infected air to acquire TB. Kissing, hugging, sharing utensils or food, and shaking hands with a person with TB bacteria won't give you the disease directly. However, you will catch the disease if you stay in close quarters with a person with TB, since you'll be breathing air contaminated with TB bacteria. Now, what are the types of TB? There are two types of TB infections: latent TB and TB disease. Latent TB, you will not show any TB symptoms if you have this type of infection. Bacteria will be present in the body, but the immune system will fight and prevent them from replicating and developing into an active disease. You will also not spread TB to others since the bacteria is dormant. Most people who inhale the TB bacteria develop this type of TB. According to the WHO, about a third of the world's population has latent tuberculosis. The only way to know if you have latent TB is through testing. Note that most people with latent TB still need treatment to prevent it from turning into active TB disease. Let's talk more about active TB. This type of TB typically shows symptoms. The TB bacteria are active and can replicate rapidly. Unlike latent TB, people suffering from this type of TB spread the bacteria to others in close proximity. In fact, they can infect 10 to 15 people in a year through close contact. So, what are the signs and symptoms of TB? A person with latent TB shows no symptoms. However, you will experience symptoms if you have TB disease. The following are common symptoms of TB: coughing that lasts for several weeks, chest pain, coughing that produces phlegm or blood, fatigue, weight loss, loss of appetite, sweating at night, and back pain. There are two main ways to diagnose TB: a TB skin test and a TB blood test. In a tuberculosis skin test, a healthcare provider will inject a small amount of fluid under the top layer of skin of the lower part of your arm, and a small pale bump will appear. You'll then return 2 to 3 days later, and a healthcare worker will check for reactions in the area where the liquid was injected. If the small bump becomes harder and rises, it might indicate TB. A skin test may, however, be flawed. The results of the test can be false positive or false negative. People who have had a BCG vaccine can have a false positive result when they undergo a skin test, yet they don't have an infection. Other people don't respond to this test after a new infection, and their result may appear to be negative. A blood test measures how strong your immune system reacts to TB bacteria. These tests typically require only one office visit. Unlike the TB skin test, you're less likely to get a false positive result even after a BCG vaccination. One of the blood tests your healthcare provider can offer is a quantiferin TB gold testing. A positive blood test means that you have been infected with the bacteria, while a negative test indicates that your blood did not react to the test and there is likely no presence of TB. E7 Health Testing offers nationwide quantiferin TB gold testing. You can order your test online and choose the testing location that is most convenient for you. After testing, you'll receive your results via email within 3 to 5 business days. If you get a positive result from the blood test, your doctor can order a chest X-ray test to check your lungs and confirm if there's evidence of active TB. So, how can you prevent TB? You can get TB if you've been around an infected person. Protect yourself by wearing a mask if there's a chance of exposure. Wash your hands regularly with soap and water. Avoid close contact with people with TB. Get tested regularly if you work or live with people who may have TB. If you have TB, you should remain at home under quarantine until a healthcare provider tells you that you're no longer contagious. Your healthcare provider may recommend antibiotics if you've been diagnosed with latent TB. It's crucial to take your treatment seriously to prevent latent TB from progressing to TB disease. Finish all of your antibiotics even if you feel totally normal. Active tuberculosis is treated by taking a combination of medicines for anywhere from 4 to 9 months. Failure to complete the medication can mean the return of the bacteria, which may be more challenging to treat as they may be drug resistant. Tuberculosis is a contagious illness that affects your lungs and spreads through the air. If you need a TB test for work or you think you might have been exposed, ask us about our nationwide QuantiFERON Gold TB testing.